It's really tragic that we do not differentiate between women's teeth and men's teeth. So often we are told as women, brush and floss. And that may well work if you're a guy. If you have healthy saliva that's alkaline and all you have is a little bit of food debris that you're cleaning from your teeth, that's great. But if you have the challenges that occur for women, which is that when our hormones change, it affects our saliva pH, then we as women are going to suffer a very different consequence. Flossing doesn't have an impact on salivary pH, obviously. And salivary pH is the problem that is driving a lot of dental issues for women. Now, diet definitely comes into play. And I'm not going to underestimate the value of a great diet. But even women who eat a healthy diet are going to be hormonally challenged when it comes to their teeth. And stress is another feature that we have to contend with. You see, when you are stressed, it is going to have an effect not only on your hormones, but on your parasympathetic nervous system. And that system has an impact on the flow rate and the quality of saliva. So when we are stressed, women's salivary pH changes rapidly. I was amazed when I started testing pH to find these variables. I was actually on the beach in Florida testing my saliva and seeing that I was enjoying a pH of around 7.4, and all I had to do was think about packing a suitcase and my salivary pH changed. Now, it may not be the same for every woman. Some women are not so affected. So you'll have to do your own research to find out how volatile your salivary pH is. And you can try. Some women try really hard to adjust the pH with their diet. And even when they're eating everything they can possibly consider eating, it doesn't have adequate impact on the pH of their saliva. And what I'm going to tell you about all these problems, what I want to tell you the solution to the problems is, of course, the complete mouth care system that I recommend, which strengthens your teeth, which deals with the imbalances in the bacteria of your mouth, and also the regular use of xylitol that helps us women with acidic saliva. It helps to control the pH of our mouth. Every time you eat xylitol at the end of a meal, you are going to raise, by stimulating a flow of saliva, it's called stimulated saliva, and stimulating the salivary flow is automatically going to usually raise it by 2 units. So if you are there at a pH of 5.5, you'll be just fine having a little xylitol frequently throughout the day. So be aware that I am not going to give you the solutions here. I'm just going to explain why women need to listen to me more than they need to listen to some of the gentlemen out there who are busy saying, well, I use baking soda, it works for me. Well, great, go ahead. But it doesn't work for women who are challenged either by the diet they eat, by the stress they're under, by the hormonal changes they're going through. And what I'm going to really stress today is what happens when a woman is pregnant. Now, it isn't just pregnancy. This is relevant to menopause. This is relevant even to younger teenagers going through puberty. Changes in the hormones, the estrogen hormones, has a very similar effect for all of us, but it's pronounced during pregnancy. And there is a saying that women in some cultures believe they're going to lose a tooth for every pregnancy. They think this is what happens when you're pregnant. It is not some unknown thing that occurs. This is science-based, and I'm going to tell you why it happens. And hopefully that will make you go to my website, drellie.com, and download a booklet and find out more about the solutions, because the solutions are the same. It's just I haven't got time to cover everything here today. So I want to talk about how when salivary pH is affected and it becomes acidic, when it becomes more corrosive to your teeth, it will dissolve minerals out of your teeth. And when that occurs, you will experience erosion. You will also experience more chance of cavities. So don't believe that your risk for cavities just happened. It happened because your salivary pH changed. And if you do the things I recommend, you will cruise through pregnancy. I cruised through 5 pregnancies, not a lost tooth in sight, and not even a cavity, not even gum disease, nothing. It is perfectly possible to do, and I'm not tooting my own horn. This is all the women that I have helped and worked with and taught, and my own children. Your risk may go up, but that doesn't mean you're going to get cavities. You can control it, and my complete mouth care system will help you do that. If you're not getting cavities when you get this erosion, the other problem can be erosion around the outside of fillings. When the enamel weakens around the outside of fillings, little bits chip off and loosen the filling. And that is when the fillings that some people think they have to have new fillings, that's because they have a cavity, but sometimes people are plagued by the fact that these fillings don't last and they're constantly needing repair. The reason they're needing repair is because of this enamel erosion. And when you control all these things with my system, with the Xylitol, you will prevent the need for the ongoing repair. And that has a huge impact for us women, because white fillings are as toxic to us as silver fillings. And this is another big differential I want to make. You can be very worried about the mercury in silver fillings, but taking them out and replacing them with white fillings is not necessarily the answer, because white fillings are plastic. White fillings have, if they don't have BPA in them, they have a BPA type substance. Today they're smarter than we think they are, because they have created these other plastics. It's still plastic, and plastic in your mouth is not a friend of people who produce a lot of estrogen. If you have a family history of breast cancer, the last thing you need is to mess with your hormones and introduce BPA at room temperature in your mouth with white fillings. I would advise you, if you're a woman with a history of breast cancer or not, to seriously consider whether you should or should not have silver fillings replaced. Maybe discuss this with several dentists before you go ahead and make a decision. Many people think, oh, I got silver fillings, I've just got to have them out, they're toxic. Well, they're toxic, but the thing they're going to put in your mouth is also toxic. So you are replacing one thing with another, and personally, I wouldn't do that. If you have no reason to replace a silver mercury filling, the mercury has probably done its damage already. I believe the damage is done as these little particles of mercury filling are in our mouth. We're swallowed after the visit to the dentist when the filling was first put in. And I believe that is toxic to the bacteria in our gut. And that is why so many people who've had mercury fillings replaced are often sick right after they are taken out of their teeth, because these particles, even if it's done safely, still exist, and I think the risk is incredibly high. And I would not, personally, I still have a couple of silver fillings in my mouth. I also have a white one done when I was at dental school, and it's never needed replacement. That's the key to all of this. Don't live in the past. What's done is done. Let's protect these fillings and make sure we never, ever, ever need any more. So that is why I have these notes here, that all fillings are a problem, in my opinion, and that the more you can focus on reversing early cavities and making sure you never need a filling, the better, especially for women, especially for your daughters, if you have an opportunity to reverse cavity for your young daughter, consider it, because you are going to change a lot of things for her and potentially for her new baby one day in the future. So let's just stop on that list here, and just to review that your salivary pH changes. It can cause enamel erosion, which can put you at more risk for cavities, for the need for fillings, for the need for repair of fillings. Anything you can do not to need a new filling, not to need a filling in the first place, do it. At least try to reverse these fillings. You have to make changes or it's not going to work. But if you make the changes and you follow my directions, you may well be able to either have a smaller filling or at least have one that lasts for the rest of your life. Now, the change in salivary pH also affects the bacterial profile in your mouth. So more harmful bacteria will be developing in the biofilm of somebody who has acidic saliva. The harmful, puffy biofilm is what we refer to as plaque. If you have plaque, you have a plaque infection. And this infection is bacteria that are acidic producing and they are acidic loving. So the more acidic your saliva, the more they will reproduce, the more acidity they create. And by creating this extra acidity, they are acidifying your mouth even further. So you have this vicious cycle of acidic producing bacteria growing in an acidic environment. And if you're eating sugar, carbohydrates, or anything that can feed them, you will be developing more acidity and so forth. And this very sad thing is that this acidic plaque-forming bacterial profile is the one that raises your risk for cavities, again, on top of that. And you may have heard how many women suffer with bleeding gums during pregnancy. And bleeding gums are even in some cases expected. I heard of somebody who went for one of the prenatal classes and was told, oh, it's called pink toothbrush. Ridiculous. Absolutely ridiculous. Do not accept bleeding gums. Bleeding gums are reversed with the use of my complete mouth care system and a decent, adequate toothbrush that you keep clean by allowing it to dry for 24 hours between uses, because bacteria die when they dry. And with this clean toothbrush, brush where it's bleeding. Massage the gums on the inside and the outside of your teeth where it's bleeding, and you'll find in a couple of days that bleeding will stop. But if you simply accept it and don't do more and don't do other things to get rid of it, it will very easily lead you down the path of periodontal disease. And I hate to tell you that 78% of women in some countries who are pregnant have gum disease. And when we know that this is the risk for preterm birth, that's horrendous when it is so preventable. And one of the studies that was done recently was a study where they gave women in Malawi who have a very high rate of preterm birth 2 pieces of xylitol chewing gum, 2 grams of xylitol. Had they asked me, I would have said that's not enough. You're not going to get results. Don't just do 2 pieces. You've got to do 5. But they hadn't got 5 pieces of gum to give all the women in the study. So they gave them 2. And they said eat 1 at night, 1 in the morning. And just chew it. You don't have to chew it for long, a couple of minutes, 15 minutes at the most. And in doing so, they reduced the incidence of preterm birth so much that they are redoing the study now to look at the changes in the biofilm that are being created by this very tiny amount of xylitol eaten right before sleeping at night and again in the morning. I've always recommended xylitol at night, last thing after cleaning teeth, for children. And now I think we have a good recommendation to recommend it to pregnant women. And maybe it's for everybody. I don't know. I haven't done that test, but with this new study that should be done next year, we should know more about the biofilm and the effect that xylitol has on it, particularly if you eat some xylitol right before you go to sleep at night, and it has then time in your mouth. As anyone who's followed my suggestions knows, I recommend that you eat xylitol at the end of a meal, and then you don't eat or drink for an hour or two. So having the xylitol at night would give you maybe 5, 6, 8 hours when you're not eating and drinking to promote the healthier bacteria. It's a very good idea. And what we also know is not only can this improvement in periodontal risk of preterm birth occur, but we know that the bacteria in the mouth of a mother has an effect on the developing digestive health of the baby in the womb. We always thought that babies in the womb, there was a sterile environment, but now we know that there is a beginning of their digestive health occurs and that the oral bacteria have an impact. We don't know all the details yet, but there is definitely an impact, and it is really important for pregnant women to be concerned about the developing digestive microbiome and to try and keep periodontal, preferably before they get pregnant, make sure that periodontal disease is under control. Now, traditional periodontal disease treatments, which is having deep cleanings and stronger antiseptics and like chlorhexidine. Chlorhexidine, when we talk about antiseptic mouthwashes, it's chlorhexidine is the prescribed antiseptic that I would not prescribe. I recommend a very gentle approach with my complete mouth care system. And what we are going to find then is not only will you likely reduce your risk for preterm birth, improve the digestive health of your developing baby, but that when you end up kissing your baby in the future when the baby is born, you will be sharing healthy mouth bacteria with that baby. And that is an ultimate goal, and that will get your baby off to such a great start. So during pregnancy, the whole conversation about mouth acidity is critical. And flossing isn't helpful, isn't going to deal with this acidic issue. And neither is traditional periodontal treatment. We have studies to show that. A very good study was done years ago showing that women who were taken care of by periodontists, very good cleanings done routinely through their pregnancy, had no different outcome. That, I believe, is because it didn't have an impact on the profile, the actual kind of bacteria that were in their mouth.